A nurse identifies that a patient's blood glucose readings recorded by the point-of-care testing device seem inconsistent with the patient's clinical presentation. What should the nurse do first? A. Assume the device is always accurate. B. Ignore the reading entirely. C. Document the value and proceed with insulin administration as ordered. D. Verify the device calibration and consider a lab-confirmed glucose before acting on an unexpected result. The correct answer is verify the device calibration and consider a lab-confirmed glucose before acting on an unexpected result. Unexpected point-of-care results that don't match clinical presentation warrant troubleshooting and possible lab confirmation before acting to avoid medication errors based on inaccurate device readings. A nurse as part of a team caring for a patient who will require long-term anticoagulation and has a documented fall risk. Which interprofessional collaboration best addresses this combined risk? A. Ignore the fall risk since anticoagulation is medically necessary. B. Discontinue anticoagulation entirely due to fall risk without further discussion. C. Coordinate between the prescribing provider, pharmacy, and physical therapy to balance anticoagulation needs with fall risk mitigation strategies. D. Address fall risk and anticoagulation management separately with no coordination. The correct answer is coordinate between the prescribing provider, pharmacy, and physical therapy to balance anticoagulation needs with fall risk mitigation strategies. Patients on anticoagulation with fall risk require careful interprofessional balancing of therapeutic benefit against bleeding risk, incorporating fall prevention strategies rather than simply discontinuing needed therapy. A nurse is part of a team where a new safe patient handling policy requires the use of mechanical lift equipment for certain transfers. Which action best supports team adherence to this policy? A. Continue using manual lifting techniques since they are faster. B. Assume staff will adopt the new equipment without any training or reinforcement. C. Ensure all team members are trained on the new equipment and reinforce consistent use of the mechanical lift as required by policy. D. Use the lift equipment only when convenient. The correct answer is ensure all team members are trained on the new equipment and reinforce consistent use of the mechanical lift as required by policy. Successful adoption of a new safe patient handling policy requires thorough training and consistent reinforcement among the team, protecting both patient and staff safety during transfers. A nurse is part of a team caring for a patient who will require long-term parenteral nutrition at home. Which interprofessional collaboration is essential for this transition? A. Coordination with a home infusion pharmacy, nutrition support team, and home health services for training and ongoing monitoring. B. No specific collaboration is needed since the patient will manage independently. C. Coordination with physical therapy only. D. Coordination with dietary services only with no pharmacy involvement. The correct answer is coordination with a home infusion pharmacy, nutrition support team, and home health services for training and ongoing monitoring. Long-term home parenteral nutrition requires coordinated planning across home infusion pharmacy, the nutrition support team, and home health services to ensure safe administration and ongoing monitoring. A patient whose partner died by suicide expresses that friends have avoided discussing the death with them. This describes A. Normal grief. B. Complicated bereavement resolution. C. Disenfranchised grief. D. Anticipatory grief. The correct answer is disenfranchised grief. Disenfranchised grief occurs when a loss is not openly acknowledged, socially supported, or publicly mourned, such as deaths by suicide, often leaving the bereaved feeling isolated. A nurse is asked to describe the concept of team-based patient education for a complex discharge involving multiple new skills. Which approach best reflects effective team-based education? A. The team coordinates the sequence and content of education across disciplines to avoid overwhelming the patient and reinforce key messages consistently. B. Patient education should be completed entirely on the day of discharge with no advance planning. C. Only one discipline should be responsible for all patient education regardless of complexity. D. Each discipline teaches independently with no coordination or awareness of what others have taught. The correct answer is, the team coordinates the sequence and content of education across disciplines to avoid overwhelming the patient and reinforce key messages consistently. Coordinating the sequence and content of education across multiple disciplines prevents overwhelming the patient and ensures consistent, reinforced messaging, particularly important for complex discharges with multiple new self-care skills. A nurse is asked to describe the professional responsibility reflected in maintaining professional boundaries with former patients. Which statement best reflects this responsibility? A. Professional boundaries may still be relevant after discharge, particularly regarding personal or romantic relationships, given the power differential established during care. B. Professional boundary considerations end the moment a patient is discharged. C. There are no professional guidelines regarding relationships with former patients. D. Former patients are treated identically to any other member of the public with no special consideration. The correct answer is, professional boundaries may still be relevant after discharge, particularly regarding personal or romantic relationships, given the power differential established during care. Professional nursing organizations generally caution that boundary considerations, especially regarding personal or romantic relationships, may extend beyond the discharge date due to the inherent power differential established during the therapeutic relationship. A nurse is asked to describe the purpose of a facility's code of conduct policy. Which statement best reflects this purpose? A. To restrict staff from reporting safety concerns. B. To outline expected standards of professional behavior and interactions among staff, patients, and families. C. To replace the need for state licensing board oversight. D. To determine salary scales. The correct answer is, to outline expected standards of professional behavior and interactions among staff, patients, and families. A code of conduct policy establishes expected standards of professional behavior and respectful interaction among all individuals within the healthcare setting, supporting a positive, safe workplace culture. A nurse is part of a team where staff have expressed burnout related to high patient acuity without corresponding increases in staffing. Which systemic, team-based approach best addresses this concern? A. Reduce documentation requirements as the sole solution without addressing staffing. B. Assume burnout is solely an individual issue unrelated to staffing levels. C. Individual staff should simply manage their stress independently with no systemic change. D. Advocate collectively, using acuity data, for staffing adjustments that reflect the actual patient care demands on the unit. The correct answer is, advocate collectively, using acuity data, for staffing adjustments that reflect the actual patient care demands on the unit. Burnout linked to high acuity without adequate staffing is a systemic issue best addressed through collective, data-supported advocacy for appropriate staffing adjustments, rather than placing the burden solely on individual coping strategies. A patient with a spinal cord injury is at risk for autonomic dysreflexia. Which action is most important for prevention? A. Restricting all fluid intake. B. Encouraging prolonged sitting in one position. C. Maintaining regular bowel and bladder programs to prevent distension, a common trigger. D. Avoiding any bladder catheterization. The correct answer is, maintaining regular bowel and bladder programs to prevent distension, a common trigger. Bladder and bowel distension are the most common triggers of autonomic dysreflexia. Maintaining regular bowel and bladder programs helps prevent this potentially life-threatening complication. A patient with a suspected pulmonary embolism has an elevated D-dimer. The nurse understands that this test is primarily useful because A. It replaces the need for imaging entirely. B. It is specific only to pulmonary embolism and no other conditions. C. A negative result has high sensitivity to rule out thromboembolism in low-risk patients. D. A positive result definitively confirms a pulmonary embolism. The correct answer is a negative result has high sensitivity to rule out thromboembolism in low-risk patients. D-dimer has high sensitivity, but low specificity. A negative result in a low-risk patient helps rule out thromboembolism, while a positive result requires further imaging since many conditions can elevate D-dimer. A nurse manager is developing a policy requiring double checks for high-alert medications. This policy is an example of which safety strategy? A. A strategy that eliminates the need for individual accountability. B. A system-level safeguard designed to reduce the likelihood of harm from high-risk medications. C. An unnecessary administrative burden with no safety benefit. D. A punitive measure targeting individual nurses. The correct answer is a system-level safeguard designed to reduce the likelihood of harm from high-risk medications. Independent double checks for high-alert medications are a system-level safety strategy designed to catch errors before they reach the patient, complementing rather than replacing individual accountability. A nurse is asked to explain the concept of non-maleficence in nursing ethics. Which example best illustrates this principle? A. Being truthful with the patient about their prognosis. B. Distributing limited resources fairly among all patients. C. Avoiding an intervention likely to cause more harm than benefit to the patient. D. Providing a beneficial treatment even when the patient has not consented. The correct answer is avoiding an intervention likely to cause more harm than benefit to the patient. Non-maleficence means do no harm. Avoiding interventions that are likely to cause more harm than benefit reflects this foundational ethical principle in nursing practice. A nurse practicing outside the scope defined by their state's Nurse Practice Act performed a task reserved for advanced practice providers. This action primarily violates which principle? A. Scope of practice. B. Beneficence. C. Veracity. D. Fidelity. The correct answer is scope of practice. The Nurse Practice Act defines the legal scope of nursing practice. Performing tasks outside this defined scope is a scope of practice violation regardless of intent. A nurse is asked to precept a new graduate nurse. Which action best reflects effective precepting? A. Assigning the new nurse only observational tasks for the entire orientation period. B. Avoiding feedback to prevent discouraging the new nurse. C. Allowing the new nurse to perform all tasks independently on the first day. D. Providing structured guidance, timely feedback, and gradually increasing independence as competency is demonstrated. The correct answer is providing structured guidance, timely feedback, and gradually increasing independence as competency is demonstrated. Effective precepting involves structured support, ongoing constructive feedback, and a gradual increase in independence as the orientee demonstrates competency, supporting professional development. A patient with a new diagnosis of acute otitis media is prescribed antibiotics. Which finding would the nurse expect to improve first with effective treatment? A. Permanent hearing loss. B. Tympanic membrane perforation. C. Ear pain and fever. D. Chronic tinnitus. The correct answer is ear pain and fever. Effective antibiotic treatment for acute otitis media typically results in improvement of ear pain and fever within 48-72 hours. The other options are not expected outcomes of appropriately treated acute otitis media. A nurse is asked to describe the concept of team resilience in the context of managing high-stress clinical environments. Which statement best reflects this concept? A. A concept relevant only to individual resilience, not team dynamics. B. Team resilience has no impact on patient care quality. C. A team's ability to avoid all stress entirely. D. A team's collective capacity to adapt, support one another, and maintain functioning and well-being despite high stress or adverse conditions. The correct answer is a team's collective capacity to adapt, support one another, and maintain functioning and well-being despite high stress or adverse conditions. Team resilience reflects a group's collective capacity to adapt, support each other, and maintain effective functioning and well-being during high stress or adverse conditions, directly influencing sustained quality of patient care. A patient with a serum sodium of 118 mg/L develops a seizure. The nurse should anticipate which treatment approach: A. Slow, controlled correction with hypertonic saline to avoid osmotic demyelination. B. Immediate large volume normal saline bolus without monitoring. C. No correction is needed since sodium will normalize spontaneously. D. Rapid correction with large volumes of free water. The correct answer is slow, controlled correction with hypertonic saline to avoid osmotic demyelination. Severe symptomatic hyponatremia is treated with hypertonic saline, but correction must be slow and controlled to avoid osmotic demyelination syndrome from overly rapid sodium correction. A nurse is asked to describe the concept of shared mental model in high-performing healthcare teams. Which statement best reflects this concept? A. A concept relevant only to physician-led teams. B. A shared mental model eliminates the need for any communication. C. All team members hold a common understanding of the patient's status, the plan of care, and their respective roles. D. Each team member operates with a completely different understanding of the plan of care. The correct answer is all team members hold a common understanding of the patient's status, the plan of care, and their respective roles. A shared mental model refers to team members having a common, aligned understanding of the patient's status, care plan, and individual roles, which supports coordinated, efficient teamwork, especially during dynamic situations. A patient with trigeminal neuralgia reports severe facial pain triggered by light touch, chewing, or brushing teeth. Which nursing consideration is most appropriate? A. Encourage the patient to chew forcefully to overcome the pain. B. Assist with identifying and minimizing known triggers while supporting prescribed pain management. C. Tell the patient the pain is not a legitimate medical concern. D. Encourage vigorous facial massage to desensitize the area. The correct answer is assist with identifying and minimizing known triggers while supporting prescribed pain management. Trigeminal neuralgia pain is triggered by light stimuli. Helping the patient identify and avoid known triggers while supporting prescribed pharmacologic management such as anticonvulsants is the appropriate nursing approach. A nurse is part of a team caring for a patient nearing the end of life who wants to remain in the hospital rather than transfer to hospice at home. Which interprofessional collaboration best supports this patient's wishes? A. Ignore the patient's preference and proceed with standard discharge planning. B. Insist the patient transfer to home hospice regardless of preference. C. Discharge the patient against their wishes. D. Involve palliative care and social work to explore inpatient hospice or comfort care options that honor the patient's preference to remain hospitalized. The correct answer is involve palliative care and social work to explore inpatient hospice or comfort care options that honor the patient's preference to remain hospitalized. Respecting a patient's preference to remain hospitalized at end of life involves interprofessional collaboration with palliative care and social work to explore inpatient hospice or comfort care options aligned with those wishes. A patient with suspected carbon monoxide poisoning has a pulse oximetry reading of 98 but presents with headache, confusion, and nausea. How should the nurse interpret this pulse oximetry reading? A. The reading is always accurate regardless of carbon monoxide exposure. B. The reading confirms adequate oxygenation and rules out carbon monoxide poisoning. C. This reading indicates the patient requires no further treatment. D. Standard pulse oximetry cannot distinguish carboxyhemoglobin from oxyhemoglobin and may give falsely reassuring readings. The correct answer is standard pulse oximetry cannot distinguish carboxyhemoglobin from oxyhemoglobin and may give falsely reassuring readings. Standard pulse oximetry cannot differentiate carboxyhemoglobin from oxyhemoglobin, so it can give falsely normal readings in carbon monoxide poisoning. A co-oximeter or arterial blood gas with carboxyhemoglobin level is needed for accurate assessment. A nurse is following up on a consult request to speech-language pathology for a patient with new dysphagia after stroke. Until the evaluation occurs, what is the priority nursing action? A. Continue the patient's regular diet as tolerated. B. Allow the patient to eat whatever they request. C. Discontinue the consult request since it may delay meals. D. Maintain NPO status or the ordered diet restriction pending the swallow evaluation. The correct answer is maintain NPO status or the ordered diet restriction pending the swallow evaluation. Until a formal swallow evaluation is completed, maintaining NPO status or the ordered restriction prevents aspiration risk in a patient with suspected dysphagia. A nurse is coordinating disaster response during a mass casualty event. Which triage approach is used to allocate limited resources to the greatest number of survivors? A. Treating the most critically injured patients first regardless of survivability. B. Treating patients in alphabetical order. C. First come, first served. D. A triage system prioritizing patients based on likelihood of survival with available resources. The correct answer is a triage system prioritizing patients based on likelihood of survival with available resources. Disaster triage systems such as START prioritize resource allocation based on the likelihood of survival with available resources, which may mean redirecting resources away from patients unlikely to survive even with intervention, to maximize overall survival. A nurse is asked to assign patients for the next shift and must decide between two nurses of similar experience levels. Which additional factor is most relevant to a fair and effective assignment? A. Current workload balance and any specific patient needs matching each nurse's recent experience. B. Personal friendship with either nurse. C. Which nurse arrived first for the shift? D. Random selection without any consideration of patient needs. The correct answer is current workload balance and any specific patient needs matching each nurse's recent experience. Fair and effective assignments consider current workload balance and matching specific patient needs to each nurse's relevant experience, rather than arbitrary or personal factors. A nurse is caring for a patient whose family follows a specific mourning ritual that involves an extended period at the bedside after death. Which action best supports this family's needs? A. Ask the family to leave promptly to prepare the room for the next patient. B. Accommodate the family's request for extended time, when feasible, in coordination with unit needs. C. Tell the family this practice is not permitted under any circumstances. D. Ignore the family's request entirely. The correct answer is accommodate the family's request for extended time, when feasible, in coordination with unit needs. Accommodating culturally significant mourning practices, when feasible, reflects culturally sensitive, family-centered end-of-life care, balanced with practical unit considerations. A patient recovering from an ischemic stroke has difficulty swallowing. What is the priority nursing action before offering oral intake? A. Offer thin liquids first to assess tolerance. B. Complete a formal swallow screen or refer for a swallow evaluation before any oral intake. C. Assume the patient can eat a regular diet. D. Provide food quickly to maintain nutrition. The correct answer is complete a formal swallow screen or refer for a swallow evaluation before any oral intake. Dysphagia is common after stroke and increases aspiration risk. A validated swallow screen should be completed before any oral intake, including medications, fluids, or food. A nurse is asked to help onboard a group of new graduate nurses as part of a structured residency program. Which approach best supports their successful transition into practice? A. Providing minimal structure and letting new nurses learn entirely through trial and error. B. Providing mentorship, structured skill-building opportunities, and regular feedback throughout the residency period. C. Assigning new graduates the most complex patients immediately to build confidence quickly. D. Limiting new graduate involvement in any decision-making throughout the residency. The correct answer is providing mentorship, structured skill-building opportunities, and regular feedback throughout the residency period. Nurse residency programs are most effective when they provide structured mentorship, gradual skill-building, and ongoing feedback, supporting safe and confident transition into independent practice. A nurse participates in a root cause analysis (RCA) following a medication error. What is the primary purpose of an RCA? A. To close the case quickly without further investigation. B. To identify underlying system failures and prevent similar future events. C. To assign financial penalties to the department. D. To identify and discipline the individual responsible. The correct answer is to identify underlying system failures and prevent similar future events. Root cause analysis is a structured, systems-focused investigation method aimed at identifying underlying causes of an adverse event to prevent recurrence, rather than assigning individual blame. A patient recovering from a severe frostbite injury to the fingers is being treated with rapid rewarming. Which nursing action is appropriate during this process? A. Massage the affected area vigorously to restore circulation. B. Immerse the affected extremity in warm, not hot water and anticipate significant pain during rewarming. C. Apply dry heat directly to the skin. D. Rub the area with snow to restore sensation. The correct answer is immerse the affected extremity in warm, not hot water and anticipate significant pain during rewarming. Frostbite rewarming involves immersion in warm, not hot water, typically 98.6-102.2 F. Rewarming is often quite painful and vigorous massage or rubbing with snow can worsen tissue damage. How many did you get right? Let us know in the comments and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.